On this Tuesday night, mounting anxiety over that mutated strain of COVID-19. The calls amp up to tighten up the border.
We remain at extreme risk right now.
What scientists say Canada lacks as hotspots shatter records. Risks in the air. The safety of flying now and how COVID is spreading. Expecting in these uncertain times.
Do I want to bring it in this crazy world?
The complications of a pandemic pregnancy. And winter storms into southern Alberta.
Stay home.
The headaches and the happiness.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. 3 days before Christmas, and health officials across this country are reinforcing the need for Canadians to abide by COVID-19 restrictions over the holidays. Look at the situation in the two biggest provinces. Quebec had its highest single-day number of cases, 2,183 new infections in the past 24 hours. Ontario was higher than that, with more than 2,200 cases. And that province has set a new record for people needing critical care. Ontario now has the most people in intensive care, 273 patients. Compare that to the highest point during the first wave, 264 people then. Ontario's most recent modeling suggests the number of ICU admissions for COVID-19 would top 300 by the end of the year. To put that in perspective, surgeries in the province need to be cancelled when ICU beds are filled with 150 people.
Canada remains on a trajectory for an even stronger resurgence over the next 2 months, and this is a perilous time.
Canada's top doctor says a rapid spreading variant of the novel coronavirus found in the UK has not yet been discovered in this country. The federal government is working with provinces to monitor it, but as Couteur explains, there are concerns about our ability to track and limit its arrival.
Is there a probability that this could enter in Canada? Yes.
Canada's top doctor believes the new variant of COVID-19 spreading fast in the United Kingdom is already in other countries. Dr. Theresa Tam says after analyzing 25,000 tests in Canada, that coronavirus mutation hasn't been found here yet. But the search continues.
We are going to be targeting enhanced sequencing efforts to the sort of high probability samples, like from travelers. So that's, obviously moving forwards. That's part of the strategy as well.
The federal government is partnering with provinces to continue that work, but some researchers say this pandemic has exposed the need for more surveillance and genomic sequencing capacity.
This is infrastructure, it is people with the expertise to do the data analysis, and it's about sustainability. So this is not something that, that we can, sink some money in and then walk away from.
There's also a focus on keeping that variant strain out of the country. The premiers of the two largest provinces, which also have the largest outbreaks in the country, say the federal government needs to do more.
The government has been calling on the feds for months for testing at airports, for further tightening of the borders. This is bare minimum we can expect.
We both worry about quarantine. We want to make sure that it's done properly, that we make sure that we have people doing the follow-up.
Public Safety Minister Bill Blair says the measures at the borders are rigorous and effective, pointing out just 1.8% of COVID-19 cases are linked to travel.
The characterization that unfortunately some have made does not reflect the accuracy and the facts of what is taking place at our borders.
And epidemiologists say it's a balancing act between personal freedoms and public health.
If the citizens are willing to tolerate more extreme draconian measures, we probably do that to drive the caseload closer to zero. But it seems to me we're probably doing all that is possible.
Including when it comes to vaccines. Health Canada now has all the data it needed from Moderna. And Health Minister Patty Hajdu said a decision on approval should be coming very soon. Robin?
Couteur in Ottawa. Thanks, Mike. The chief executive of BioNTech is confident the company's coronavirus vaccine protects against the new variant, but further studies will still need to be done.
You have just to calculate that 99% of this virus protein is not changed. Only 1% is, or less than 1% is changed. So the likelihood is high that the vaccine can deal with that. But we have to do the experiment.
After many European nations moved to isolate Britain because of the new strain, the French-UK border is about to reopen. The two governments have just reached a deal that would allow EU nationals to travel subject to a negative COVID test. Caught in the middle of this mess, truck drivers trying to move goods. Our Europe Bureau Chief Goomansingh has the latest.
Once a landing strip, now a giant parking pad. The British government planned to use the Old Manston airport for Brexit-related shipping issues. But this is a COVID-19 problem.
We don't know why we have to be in that situation.
Sunday night, France shut its borders with Britain over fears of a new strain of COVID-19. The move stranded drivers who for months have been hauling goods between the UK and France. The Road Haulage Association says drivers are being treated inhumanely. The European Commission is calling on all EU nations to reopen borders. I've been stopped for 3 days, he says. We're asking for a solution, something that they can tell us that will help us. Testing of all drivers could get goods flowing again, but that will take time. It's estimated more than 2,000 truckers are lined up on highways, parked at service stations and rest stops. Drivers say at this point, they won't get home for Christmas.
It's done. It's finished. From here to go home, we have about almost 2,000 miles.
Shoppers could be hit as well. Two of Britain's largest supermarket chains, Tesco and Sainsbury's, says delayed deliveries could lead to some items not being available. British Prime Minister Boris Johnson tried to ease fears over possible shortages Monday, saying only goods handled by people were being held up at the Port of Dover.
That is only 20% of the total arriving from or departing to the European continent, which means the vast majority of food, medicines and other supplies are coming and going as normal.
With another day of work lost, a crowd gathered near the Port of Dover. They booed and yelled into the night, sidelined by a virus they can't control. Goomansingh, Global News, London.
The University of Toronto is keeping a tally on the number of Canadians vaccinated. As of last night, more than 20,000 have had their first shot. Quebec has administered the most vaccines, followed by BC, Ontario, and Alberta. There is still no program in Canada's north because of the vaccine's complex storage needs. In other news tonight, a dissident Pakistani human rights activist who was living in exile in Canada has been found dead in Toronto. 37-year-old Karima Mehrab was granted asylum in 2016 after her work led to threats from Pakistani authorities. Global's Miranda Anthistle is following the story for us. Miranda, what are police saying?
Well, Robin, the body of 37-year-old Karima Mehrab, also known as Karima Baloch, was discovered by police on Monday. She had first gone missing this past Sunday after going for a walk down by Toronto's waterfront. Now, police say they are not treating her death as suspicious, but the well-known Pakistani activist's friends and family say they don't believe that this was an accident. Mehrab was the leader of a student group that advocates for the independence of Pakistan's ethnic Baloch areas. They accuse Pakistani authorities of human rights abuses in Balochistan. That's the largest province in Pakistan. Mehrab was one of the region's first women to take part in politics as well, and she inspired hundreds of other young women and girls to follow in her footsteps. Her friend Latif Johar, another activist, says she was forced to seek asylum in Canada after being threatened by the Pakistani government. This was several years ago, but he says the threats never stopped as Baloch continued her advocacy work while in Toronto. Johar and other friends and family of Mehrab believe there was foul play involved in her death.
There are open threats to us. I saw this screenshot. I saw the messages she showed me from Pakistan's intelligence agency saying if she don't stop, they're going to do something.
Several agencies, including the Human Rights Council of Balochistan, are calling on the Canadian government to further investigate Mehrab's death. Robin, we'll send it back to you.
Miranda Anthistle in Toronto, thank you for that. It'll be a white Christmas in southern Alberta. People there are spending the day digging out from a blast of winter that saw as much as 70 centimeters of snow. As Heather Yourex-West explains, Mother Nature teamed up with public health orders to keep residents at home.
A snow day without snow tires. It's a tough lesson learned.
Disaster morning because I tried to go to work but it's impossible. You know, the snow is very hard and I'm stuck. I can't move. It's very hard situation, right?
Winter began with a wallop in southern Alberta, between 20 and 40 centimeters falling in the city of Calgary, the mountains seeing even more.
Kananaskis unofficially reporting as much as 70 centimeters. Places just west of Calgary, like Bragg Creek, over 50 centimeters. So this is one of those particular systems that has spanned over a couple of days and is bringing significant and historic accumulations of snow.
The snow creating chaos on the roads. We are experiencing issues on all routes, tweeted Calgary Transit Tuesday morning. All routes are running behind. Do yourself a favor, YYC, tweeted this resident. If you can stay home, do it. I'm stuck outside my own house waiting for a tow. In total, Calgary police responded to more than 50 crashes on Monday and Tuesday, though none involved serious injury. Many looking to take advantage of the powder on nearby ski hills were disappointed. Sunshine Village says it was forced to close its access road because of the high volume of skiers and snowboarders.
It is a different year. It's a very different world that we find ourselves living in, and our capacity has been reduced substantially just due to the limitations on our infrastructure, especially our gondola as well as our parking lot.
Still, for the COVID restriction weary, the fluffy white stuff served up some much needed fun.
It's good for Christmas, right? It'll make a nice white Christmas for everybody. We're all stuck at home anyways, so might as well enjoy it. Get out and enjoy it if we can.
And there will be time. With this much snow, the white Christmas likely to last into the new year. Heather Yourex-West, Global News, Calgary.
To fly or not to fly, coming up, the conflicting science over the safety of air travel. How safe would you feel on a plane right now if someone sitting near you wasn't wearing a mask? Today, Transport Canada revealed dozens of travelers have refused to wear masks on Canadian Airlines. The data shows that as of December the 8th, 9 passengers were fined for not wearing masks. Fines can range up to $5,000. 63 warning letters were also issued. Masks are among the measures to protect passengers and crews. Flights are still coming and going despite the pandemic. But how safe are they? Mike Drolet looks into the studies that still show uncertainty.
The trickle of passengers traveling through Canadian airports is less festive than in past years. Not everyone is willing to get on a plane in a pandemic.
Are you joking?
In frigid Quebec City, the lure of sunny Mexico proved too enticing to pass up. If we take precautions, says this traveler, the government says there's little danger. But that's not entirely true. The science on air travel safety during a pandemic is full of contradictions. One study showed 15 passengers sitting in a cluster were infected by one symptomatic passenger. Yet a more recent study concluded you would have to sit next to an infected person for 54 hours to catch COVID-19. Confusing? Well, that first study was done before masks were commonplace, and the second one was done using mannequins who were wearing medical-grade masks. And those mannequins obviously weren't eating, drinking, or moving around like humans. For epidemiologists, gauging the risk comes down to wearing masks, distancing, and being around crowds of anonymous people. And there have been cases on Canadian Airlines, over 2,000 in fact recorded since March by the Public Health Agency of Canada. A closer look at the numbers shows a steady increase since the summer, followed by a spike in November. And that means, however unintentional, COVID is traveling from city to city.
It doesn't swim or walk or fly on its own. So when you're trying to control a global pandemic and you're allowing a lot of travel back and forth, you're creating a very dangerous situation.
And with an increase in flights around Christmas, epidemiologists fear COVID-19 will land in otherwise untouched areas, which could lead to more outbreaks and ultimately overwhelm an already maxed out healthcare system.
Studies out of Ireland had shown a few people flying in that were pre-symptomatic, and before they knew it, they had 18 individual outbreaks in Ireland following one flight. So it is known to happen.
Will it happen in Canada following this Christmas travel season? We'll know in January. Mike Drolet, Global News, Toronto.
It's believed that COVID-19 has now reached every continent on the planet. There are reports of an outbreak in Antarctica. According to Spanish media, 36 people at Chile's Bernardo O'Higgins research station have tested positive for the virus. The Chilean Navy says 3 crew members of a ship that brought supplies to the station last month tested positive upon return. All those infected at the research station have returned to Chile, where they are now in isolation. Antarctica has no permanent residents, but about 1,000 international researchers and visitors are on the continent. Still ahead, why is Trump still in denial when he should be preparing to leave the White House?
Thank you so much.
2 thumbs up from America's top doctor who received Moderna's COVID-19 vaccine today. Dr. Anthony Fauci urged others to roll up their sleeves.
I feel extreme confidence in the safety and the efficacy of this vaccine, and I want to encourage everyone who has the opportunity to get vaccinated so that we could have a veil of protection over this country that would end this pandemic.
Moderna's COVID-19 vaccine is the second shot of hope as cases surge in the U.S. More than 18 million people have now been infected with COVID-19 in America, and more than 330,000 people have died. Tonight, President Donald Trump is focused on the election he lost. Even senior Republicans are telling him it's over. Jackson Proskow has more from Washington.
There's no question Joe Biden will be the next president of the United States.
It's time to unite, to heal, to rebuild.
That hasn't stopped President Donald Trump from fighting to overturn the election he lost, relying on wild conspiracy theories and outlandish suggestions from his few remaining loyalists.
He could take military capabilities and he could place them in those states and basically rerun an election.
In recent days, Trump has met repeatedly with conspiracy theory touting lawyer Sidney Powell and gathered a group of sympathetic Republican lawmakers.
We aren't going to let this election be stolen by Joe Biden and the Democrats.
To plot out ways to ignore the will of voters and disrupt the transfer of power.
Biden won handily. It's not even close. And yet Republicans are following the sore loser lead of Donald Trump. And that's dangerous in and of itself.
Trump's last chance to upend the process comes January 6th, when Congress meets to count the Electoral College votes.
Donald Trump of New York.
As vice president, Joe Biden presided over the count that certified Donald Trump's 2016 victory. He even shut down the objections of some fellow Democrats.
It is over.
This time around, Mike Pence will preside over the count acknowledging Biden's victory, where Republicans have made it clear they will raise objections and delay or disrupt the process.
These individuals who are pro-Trump and in Congress can delay the inevitable by a day or two, and that's it.
Republican leaders in the Senate have already acknowledged Biden's victory and cautioned their colleagues about forcing a messy public showdown, one that would pit Trump loyalists against Republicans who are in fact ready to acknowledge reality. That hasn't eased fears about what else Trump might try to do between now and Biden's inauguration. At the very least, his efforts have worked to sow doubt about the legitimacy of Biden's win, which will make life much more difficult for the incoming president. Robin?
Jackson Proskow in Washington. Thanks, Jackson. Up next, pandemic pregnancies, what to expect when you're expecting during COVID. You better watch out. A paragliding Santa Claus learned that the hard way when his souped-up sleigh hit some power lines in California. He was delivering candy canes to local kids. It took fire crews an hour to get him down as the lines had to be de-energized. Luckily, this Santa wore a seatbelt, which saved him, according to officials. We've been stuck in this pandemic for much longer than any of us imagined back in March. That's made a difficult life choice even more challenging for couples hoping to expand their families. Ross Lord spoke with some Canadians who are expecting about their unexpected issues.
Their gender reveal party was small but precious, like the baby boy Stacey Van Tassel and her partner Tyler are expecting 4 months from now.
We wanted to have a baby, but at the same time, it's just like, do I want to bring it in this crazy world that's going on right now?
It's been exciting and it's been tough. Along with the typical nausea, Stacey has felt stress over COVID-19 restrictions. Limits on the number of people at medical appointments have at times excluded her partner. He will be present for the birth of their son. Stacey's mother won't be.
The hardest thing for me right now to wrap my head around is not being able to have my mother in the room with me.
In Vancouver, Fernanda Villalobos is 34 weeks pregnant with her first child.
We are both privileged enough that we have job security and we can work from home.
Like Stacey, she also sees the upside of a pandemic pregnancy.
I've really enjoyed being able to be with my husband, who's home as well. I think him witnessing all the changes, both physical and emotional, has made us both better partners.
Staying in means less pressure on expectant moms to go out and pretend they're feeling well when they're not. But as Nova Scotia mother-to-be Katie Ryerson is discovering, relaxing is a luxury.
It's the unknown of what, the rest of our appointments and what delivery is going to look like. And then the unknown too is, of course, the really scary thing of thinking of what if I did get COVID, how is that going to affect me and my baby?
Early research shows pregnant women may be at higher risk of severe outcomes if they get COVID-19. And the vaccine's effect on pregnant and breastfeeding women is unclear. Evidence from an American think tank suggests there could be a COVID baby bust, that job loss in devastated economies could lead to fewer births. Those who didn't shy away will have profound memories from a difficult time.
Hopefully we'll look back and think that, yeah, fingers crossed.
Ross Lord, Global News.
And that is Global National for this Tuesday night. I'm Robin Gill. We leave you tonight with some Christmas spirit.
Rudolph the red-nosed reindeer had a very shiny nose.
Even in the pandemic, the show goes on for Michael Bublé. In a new video, the singer teamed up with hockey player Elias Pettersson to bring his trademark holiday cheer to families at Vancouver's Canuck Place Children's Hospice. Thank you for watching, and I'll see you back here tomorrow. Have a great night.
Story. That was beautiful. Merry Christmas. Happy holidays. God bless you. Let's go into 2021 and get out of 2020. What do you say? I love you guys.